Hi, good evening, friends. And it's a pleasure and delight to welcome you all to the second session in this series of providing healthcare effectively and safely in times of the COVID-19 crisis. And today's webinar is directly focused to the medical specialties and the doctors working in the medical areas. So to begin the seminar, I'll throw open one of the polls and just to see what is the composition of the audience today. And I'm now going to throw open the first of our polls, which will appear on your screen, and it will ask you what department are you from. So just click on which department you are from, and we will get the results in a second. So poll is in progress. It's open on your screen. And just to get a feel of how many people are from which department. So the poll, I'll close the poll in another 10 seconds. So we will get a feel of what is the status of our audience. I hope everyone has answered, and I'm closing this now. So we have an equal mix of dermatology and medicine. So we have about 30% audience from derma and 30% audience from medicine, whereas about 10% or 15% audiences from radiology and community medicine. However, this is likely to change as we progress further in the webinar. I'm also going to throw open the second poll here for you, so that again, trying to get a feel of what the audience is. So this poll says, what is your designation? And this is on your screens, and the poll is in progress. So we will know again what is the feel of the audience that we have. So I hope you have finished answering this poll as well. Cool. And I see that half of the audience is already a resident, and half of you all are faculty members. So that's kind of perfect, and we are in a good shape. So let's launch into the webinar further. And to begin again, I'm just trying to figure out what you might be thinking. And most of you might be thinking, what new is this webinar going to tell us? We probably know practically all that is there to know. Or why are we on this webinar? It really doesn't concern me. I'm not involved in patient care directly. I'm a community medicine resident. I'm not working in patient care areas. Is it really necessary for me? So to answer those questions, I just have one thing for you. If you are thinking that, just remember that सबका number आएगा. And actually, अगर आप GTB में काम कर रहे हैं, तो आपका नंबर तो practically आ गया है. So let me introduce our faculty members for today's webinar, and we have on the panel Dr. Piyush Gupta, who's Director, Professor and Head of the Department of Pediatrics, Professor Subhash Giri, who's Director, Professor of Medicine in the Department of Medicine, and Dr. Shruti Srivastava, who's Professor of Psychiatry, and Dr. Rahul Sharma, who's Associate Professor of Community Medicine. I'm opening the panel to you, and I will request each of the panel members to introduce themselves in a minute, and then we go on further with this webinar. Yes, Dr. Shruti.
Yeah, a very good evening to all of you for joining us in the evening hours. And it's a pleasure for us to be here and we just my purpose is to address the mental health issues, which I'll be briefing whenever my turn comes.
Cool. Dr. Rahul.
Hi, good evening, everyone. All the and quite a lot of people are already here, and many are joining us even as we speak. I thank all those who took the initiative of having this most wanted talk that is required by all of us here. As Ashish said, we are plonked in the middle of something that we all were least expecting, but we all are now part of it, whether we want it or not. And I'm sure this initiative will go a long way towards assuaging all of our apprehensions regarding what to do in the matter, and to be role changers and agents of change for what is going to happen there, and for something that is going to stay with us for a long period of time, unfortunately, whether we want it or not. So I hope it's a good learning session for all of us involved. Thank you.
Thank you, Rahul. Professor Giri? We can't see you, but I'm sure that we can hear you. Professor Giri, if you could introduce yourself. We will let him have to sort out his microphone issues. In the meantime, I'll invite Dr. Piyush Gupta.
Hello, good evening, everybody. I hope you can hear me. There's some issue with my camera, so maybe you may not be able to see me. So welcome you all. This is a group formed by our esteemed medical director because there have been increasing incidents of COVID infection in the healthcare workers, and so he wanted that we should train each and every physician, other healthcare workers, nurses, all the people who are working in the hospital, paramedics, how to save yourself from this infection. And this is very important, not only at home, because you are saving others, but saving yourself is much more important, because only when you are safe, you will be able to make others safe. So I am thankful to my team, Professor Ashish, then Dr. Asha Tyagi from anesthesia, Dr. Amir Maruf Khan, and Dr. Arun Sharma, who are giving all technical support from the medical education unit of UCMS and GTB Hospital, Dr. Binita Kashyap from microbiology, Dr. Pratima from dentistry, and Ms. Pramila from Hospital Infection Control Committee. So I'm thankful to all who are taking part in this series of webinars, and Ashish is doing a major job of coordinating and training all the doctors and physicians. This is the second of the webinar, as you know. The first one was for surgical specialties, where 9 departments were invited, and today I see I think there are more than 150 there, Ashish?
There are 59 at the moment. 59 at this time.
Okay, so we have 6 departments, rather smaller departments, so hopefully others will join soon. So I'll not be an obstacle between you and Ashish anymore, and I wish all the success for this webinar. Thank you. Thank you, Ashish.
Thank you, sir. Professor Giri, if you're able to sort out your mic issues, may I hand over the mic once again to you? Probably still some issues. So we will go ahead with the current webinar in the present format, and then we will work out later. So in this webinar, I'm going to talk of some general information and tips, some focused address, practical. Yeah, Dr. Giri, I think now you're audible. Yes, would you have your opening remarks here? Yes.
Good evening, everyone. Thank you, Dr. Ashish. The talk is for the time of the hour. Actually, we were having the disease for last few months all over the world. And when it came to Wuhan, actually, we started discussing about it. Me and Dr. Ashish used to discuss and actually spotted the emotional outcome out of the fallout of this calamity all over the world. When it came to Italy, it actually reckoned our quite confidence, but slowly we build up our this thing and come up with all the elated mood, and we boosted our team and then started facing the disease when it came to our doorsteps. Say in March, it has started with us, and slowly now the things are becoming better at our level. Say getting the logistics, getting the PPE and all. We are now fully prepared to face this pandemic. Let's hope we have the lesser calamity in our community, and our healthcare system should not collapse, and we all will be facing it and will be solving. At one time, we will all be winner. That is the thing I would like to know. I like to convey to all the audience. Most of the people must be knowing I'm Dr. Giri, working here as a faculty in the medicine. Thank you.
Thank you, sir. So what I was taking you through was the overview of the presentation. We will start with some general information and tips. Then we will have some focused address on medicine and allied sciences and how you can protect yourself in these times. I'll talk about some myths on personal protective equipment, and then we will talk about the report, the positive report and the negative report. We'll talk a little bit about taking the infection home and what happens when you get exposed. So those are the broad categories in which we will be discussing the subject today. Some of you might also be feeling that you probably know all this, and I really do not have anything very new to tell you. I do agree that yes, most of the things that you will hear in this webinar will be repetition and will be just reinforcement of what you already know and would not be anything really new. But I also feel that there will be several things that each one of you is practicing, which may or may not be there in the guidelines, but which you have worked out as your own self, and you have worked out as your own thought process tells you that this is the best way to protect yourself. And if you do have certain tips and suggestions which everyone else can also follow, please feel free to raise your hand or to type in the questions or the chat boxes, and I will take them up as we go along. So from here, I would like to play a welcome message that has been recorded by our medical director for you. And earlier he was planning to be on this webinar, but probably there was some meeting which had come up. So he sent this web message. I will play this 3-minute message for you as we begin this, and then we go on to the major content.
Good morning all. I am your director, Dr. Sunil Kumar speaking. I welcome you all to this class where you will be taught how to keep yourself safe while taking care of the coronavirus patients. A training cell has been constituted at GTB Hospital under the chairmanship of a great teacher, great friend of mine, Professor Piyush Gupta from the Department of Pediatrics. He is the ablest person to deal with such issues, and there are many other colleagues such as Dr. Asha Tyagi, Dr. Ashish Goyal, Dr. Maruf, Dr. Pratima. They are equally competent, they are equally good teachers, and they are equally great friends and great human beings. They are going to be part of your training, how to protect yourself while delivering the care to the suspected or confirmed coronavirus patients. As you all know, that we are passing through an pandemic rather, of COVID-19, and we know for sure that we are dealing with many suspected COVID patients who are turning out to be COVID positive later on after the investigation. So therefore, it is very important, and it's a very, very infectious disease. That also is known to all of us. Therefore, it is important to protect ourselves while we deliver the care to these patients. They are sick patients. They may not be sick patients. They may be asymptomatic, but they still require consultation or some care. And similarly, if they are very sick, they require a lot of care in terms of respiratory care, the multi-system care. And during that time, it is possible that you may be exposed to the danger of acquiring coronavirus infection to yourself. And therefore, it is important to protect yourself so that you do not carry this infection to your family, to the society, and you are able to break the chain of infection. You know that many doctors, many healthcare workers have died in the line of duty throughout the world. We don't want any harm of any kind to happen to my GTB hospital doctors, whether it is an intern, whether it's a PG, whether it's a JR, whether it's a SR, or it's a faculty member or general duty medical officer. I want all of you to be safe, and safe, 100% safe. And therefore, this training cell was constituted, and they have taken out a lot of time from their routine work, their family work, from their family time, and they have taken a lot of pains to develop the methodologies, to develop the videos, to develop the talks, to tell you how to keep yourself safe. So please do learn all the things that they're going to teach you to protect yourself. They are very simple. The only thing is that you have to pay attention to all these and you have to keep all these things in the mind to keep yourself safe. So please do learn, be interactive during these sessions, ask your queries. They will be happy to respond to all those queries. It is important that you remain safe. You are the backbone. All of you are the backbone of GTB Hospital. GTB Hospital is very proud of you. I am very, very proud of you. I want you to be safe. Please take care and learn everything that the training cell under the charge of Professor Piyush Gupta and other dear colleagues, they will teach you. Have a wonderful time. Be safe. Take care. God bless you. Thank you and namaskar.
Thank you. So yes, the healthcare workers are at risk, obviously. Are you at a greater risk? Definitely, you are certainly at a greater risk. As many as 25 or more healthcare workers from our hospital have already tested positive and are in various phases of illness. Some have recovered from the infection, have tested negative and have come back, and some are still in quarantine and isolation in different facilities around the city. The Lancet editorial on March 21st on protecting the healthcare workers again throws this aspect into limelight, and it tells us that yes, we are at a greater risk. But being at a greater risk probably does not mean that we are at a greater risk of complications. So although we may be at a greater risk, but certainly we may not be at a greater risk of complications, because those are dependent only on the disease or the health status of the individual and the age that has what has been seen. So even if we are at a greater risk, we may not be at a greater risk of complications at this point of time. So there is some tips on general advice in the hospital. As all of us know, this is a droplet infection, obviously, so it does not travel very far from the individual who's transmitting it. Use of elevators and lifts. It is best to avoid elevators and lifts. We have only 7 floors in our hospital, and if you are climbing several floors through the stairs, it's a good exercise. So unless you are in a state where you are unable to use the stairs, it's better to avoid the elevators. If you are using the elevators, stand facing the wall. And if it's very crowded, it's better to wait a little longer than usual, even if you have to take the elevator. Usually when you are in patient care areas, it is a good advice to use an observer or a buddy of yours who will observe you and give you feedback on how you use hand hygiene, how you handle your mask, and how you go ahead and wear your PPE, donning and doffing. Because at times we feel, hame to sab kuch aata hai, I'm doing everything right. But actually there are problems, and it's when you are observed and given critical feedback, then you will actually realize what were the mistakes. We all have a habit of touching your face so many times, and probably if you see this webinar, you will realize that I do that so many times as a tip myself. So all these things are better observed, and when you get a feedback, you are able to modify your behavior. Referral is the second thing I want to talk about. So whenever you're writing referral, please think again, do you really need a referral on this patient? At these times, the lesser interactions you have, the better it is. So if you really need an interaction or a referral, if there is a real question that's bothering you, make that referral as specific as possible rather than keeping it general, and that creates more issues than really solves when you get different kinds of advice. There are some general precautions that you need to take all the time so that you're not caught unaware. You sanitize your keys, glasses, pens. This is very general advice. And life without a phone is possible. So if you are in patient care areas, please try and avoid using a phone. If you have to use it, please keep it packed in a case or in a plastic bag so that when you leave the hospital, you discard the plastic bag and take the phone home after you have sterilized it, because when you go home, your family gets exposed to that phone much more than you do. I go into clinical care directly from here, and to offer safe, ethical, conscientious, and scientific care, I would again bring back Professor Piyush Gupta for his inputs at this point of time and at this stage. Professor Gupta. Well, I think there is some issue with his device, and he's not able to join in. That's what he tells me. So we go ahead from here. And the clinical care in COVID times, I have divided into 4 areas. One is the outpatient care area, in which we have the fever clinics, the physician and non-physician outpatient departments, the inpatient care, the intensive care or the ICU, and the emergency areas. So going on to the outpatient or the fever clinic, I know it's summer, it's middle May, and it's extremely hot in the summer, but it's best to keep the temperature of the air conditioner, if you are using it, to a highest tolerable level. Please use the exhausts and open those windows. Oftentimes when I go to the OPD and other patient care areas, I find that the windows are closed. So unless you open the windows, there is not going to be circulation. All the droplet that has accumulated remains stagnant in the air, causing more infection and more exposure to whoever is working in that room and the outpatient area. So it's a good advice to use those exhausts if they are there, and to open those windows to maintain a good circulation as you work in those areas. Use your face shields. All of you should have face shields in the patient care areas. If you do not have face shields, please get them. There are enough videos on the YouTube and on social media platforms which tell you how to prepare your face shields. So if you think this particular webinar is going to tell you how to make face shields, no, we're not going to do that. If you feel that this is telling you how to don your PPE or doff your PPE, no, we're not going to go into those details. All those have been placed in the handouts, and you are welcome to go and see those handouts as you go along with this webinar. So most of your follow-up patients and your previous patients may have your phone numbers. Telemedicine has been adopted in several hospitals, may not be a reality in GTB Hospital and some of the other hospitals. So if telemedicine is not a reality in your hospital, even then you can handle a lot of patient care related problems on the telephone. Encourage patients in these times to use the telephone and ask you to attend to minor complaints and problems if they are in follow-up. It will avoid an unnecessary contact and may actually be preventive and may help you avoid that infection that you have been dreading. If you don't know how to use telemedicine, well, learn it. If you are into inpatient care, it's always good to turn the head of the patient to the opposite side. If you're auscultating, taking blood pressure, giving injections, drawing blood, or doing procedures, or in any logical situation where you need to go to the patient, it's always more advisable and wiser to play safe than sorry. I often see that residents would be going into the patient care areas repeatedly for several things that they could have done in the same visit. Plan, plan, plan. So make a list of what you need to do with this cubicle, with this ward, with the patients who are in this particular ward under your care. If you have planned and made a list appropriately, then you can achieve much more in your visit and will reduce the number of visits and will allow you to do multiple tasks in one visit without exposing you to the same patients again and again and again. Use your clinical judgment. This is actually the time, or these are the times when we really need to use our clinical judgment much more than anything else than any time before. If you use your clinical judgment appropriately, a lot of the time that you spend in thinking and deliberating is actually saved, and your exposure time is definitely reduced. Be on the guard all the time and don't get caught unaware at any time. Use your protection, be safe, and stay safe. In intensive care areas, it's important to be quick and to be decisive in these areas without deliberating or procrastinating on what you need to do and what needs to be done. Get your basics in shape and take your decisions quickly. There is so I have put this point as don't try to be the Superman in a fashion parade. It's directed towards some of my postgraduate students and residents whom I've observed over time. They would be in the ward in the funniest of clothes at these times and would not be donning PPE. I think all of you in this webinar are already adults and can take care of good and bad for yourself. So there is, I know it's uncomfortable, I know it's summer months, but there is no going to come after you to make you wear PPE. Please wear effective protective equipment without anybody requiring to tell you that you need to be in PPE. When you're intubating or doing any procedure which has a potential to create more aerosols, and if you're doing any aerosol generating procedure, it is advisable that all other staff which are not required in that room to stay outside that room when the patient is being extubated, intubated, or suctioned. We already have one case in our hospital who has tested positive while she was just present in the room where an intubation was being carried out. And that was the only exposure she had, and she tested positive. At this point, I would again like to bring in Professor Giri, and I would open the mic to you. And sir, would you please have more tips on taking care of patients in the hospital and how to stay safe? Dr. Giri.
Yeah, thank you very much, Dr. Ashish. Actually, I take it up like this. One is that how should we face this epidemic? First, let me focus on our own health first. Let me take proper diet, do the regular exercise, try to maintain our weight. I can quote here that one of our esteemed faculty who is sitting here only, he has made his health in a good shape. He has shed off some few kgs of weight, and that is good for the long term. A regular exercise is very important. 30 to 40 minutes exercise everybody should do so that the immunity get boost. Secondly, we should all get our health checkups or see our what is the, especially if I talk about the senior faculty, what is our blood sugar and how it is going on. If it is normal, that's okay. If it is higher, then it must be controlled. How is our blood pressure? Are we controlling it? Is it all right? Are we taking all the drugs regularly? We should always focus on these issues. The person who are having the respiratory conditions, the person who has other illnesses. I'm concerned about the, say somebody has some malignancy or somebody has some CKD or somebody has having the chronic liver disease. So these are the points where one should focus. And these all people should go at the backstage. They should report these illnesses to the administration and take up leave, or they should be at the back bench, or they should do the other works rather than facing the patient straightway. I'm coming to the residents. Some of the residents are having tuberculosis either in the past or present. Usually we take it up the one who has the tuberculosis. These are the people who have a lower immunity or presently who is taking the ATT should not be put up on the first line. And all the faculty or the other senior people should see to it that any of our residents should not, or any of our healthcare worker who is having this condition should not be posted at the front line. Then I'm coming to the another aspect. One is a physical health, which I have spoken to you. Then is our illnesses, I have spoken. Then is our mental health. That is very important. You should have a very high mental boost to face up this disease. If you do not have this stress, if your colleagues are supporting you, if your family is supporting you, if your seniors are supporting you, you have a good moral boost. You are not likely to acquire infections. You are likely to be in a good shape of mind. You will do all the proper steps of protections while you are dealing with the infections. Now I am coming to the another point which we are probably lacking here is a training of the lower staff. we actually have a link with the sisters and links through the NOs and the sweepers, or you can say Swakaramcharis. So if these people are taking proper precautions, then our doctors, whether they are taking the precautions or they are not taking the precautions, is useless, because every time we are interacting with these people. So a proper training of the NOs who is doing a lot of procedures with the patient, who is helping many procedures with the sisters. This Vikramchari who is packing the body, he should be trained how the body should be packed properly, how it should be desanitized, and how the thing should go in a proper way as far as the protection is concerned. These were the points which we probably highlight. Basically, most of the things we know, and many of the things has been already conveyed by Dr. Ashish, or you must have read about it. But still, these are the point where you can try to focus. Then another point which I sometimes found, that we are taking adequate precautions ourselves, but the other person is not taking. The other person is casual, whether it is the security personnel, whether it is the relative of the patient, or whether it is the some other worker. So you try to force them to take all the adequate precautions. Ask them at whatever area you are, according to that area, those precautions must be ensured. After the training part of the worker is concerned, and when the health of the healthcare worker is all right and he is being put up to the area, another point where probably administration or the head of department will be taking up some issues. Here comes the logistics. Say a proper reception should be there, where a person who is entering into that facilities, whether it is any of the indoor facilities or the intensive care facilities, there we should have the reception, and at the reception there should be a hand hygiene policy. A mask should be given to the person whosoever is entering, and there should be a minimum entry. When we talk about the ICU, no entry should be allowed except the team which is treating the patient in that. So another point, as far as the logistics is concerned, I'll go ahead with already the central ACs are off. Maybe we can plan the ACs which are having the HEPA this filtration. Probably that will help. Or if these things are not being provided, even with the AC, we should have a proper exhaust in all the facilities, whether it is the ICU or whether it is the CCU or whether it is the triage area. So proper exhaust, ventilation, window AC, or sometimes you can even think of putting up the because it's going to be very hot summer. So there we can think of putting up the coolers also. Maybe slightly better than the AC if we put up the coolers in these areas. Then we coming to the donning and the doffing areas. We are having some problems not having the proper donning and doffing areas. The senior faculties, or I'll say the head of department or the administration, should isolate certain areas where we can have the proper areas for the sterile area for donning and unsterile area for the doffing. The residents are doing the donning and doffing in the routine wards, and that aspect should also be taken up collectively by the team who is doing the work. Then as far as the bed is concerned, we are having beds in a ward where maybe sometimes the 6 feet distance is not there. Probably we have to sit, and we have to take it up the issue whether we should do the shifting of the head of one patient to the other side, that can help, or should we remove some of the beds out of the ward. Then again, if we talk about when we have to interact with the outside crowd, when you are in an inside facility, whether it is a ward or the ICU, then we should have some curtain, like we can have the plastic curtains. There you can interact with the relatives, and even I will advise if the plastic curtains can be put between the beds, so that the patient cannot pass on that infection to the other patient, or even the doctor can talk to the patient if it is not touching or doing the procedure, or close examination is not required. Even through that screen, one can talk to the patient. These were the few things which I was thinking as far as the logistic is concerned. Now I think as far as the PPE and 95 masks, the goggles, the face shield are concerned, our administration have done rightly, and they have done a lot of effort, and now they are providing us with all the things, and we are getting the noise approved PPE. So we are happy about it, and we are not facing any problem in the future. Although, as Ashish has conveyed in one talk, that probably when the things will deteriorate, then we may face some shortage of PPE. and there again we have to sit, and again the higher administration have to take care, and the priority of the healthcare worker has to be kept at the top to maintain the chain of these PP. Then as far as the infection is concerned, when we talk about the individual infection, then usually where are we lacking? Are we doing the proper hand hygiene? Are we putting on the donning? Are we doing a proper way of doffing? If we are not doing, maybe sometimes Dr. Asi said, okay, we think that we are doing it rightly. Are we really right? The other person can tell us. So there should be one person who is observing you, whether you are doing it rightly or you are not doing it rightly. So that aspect is very important. So one person who is donning, there should be another person who will help him and will observe that somebody has not done this part. So when he is donning, then a frequent hand hygiene should be done. And everybody, including the faculty and the resident, we should see those videos where the procedure of the donning and doffing is done. And then disposal of the our waste which we are using should be done in a proper manner. There I was thinking probably we may be lacking a few of our few healthcare worker may be having some problem in doing that. Actually, there was a study in Europe where they have found that probably few workers are getting infected more frequently than the others, or sometimes they are getting a repeated infection. Then it was found that those are completely casual people who are not taking all the precautions. Most of the time, the PP is not defective. It is the method which we are using it is usually defective. We are using when we are having a gloves on, sometimes people touch anything. No, your gloves are getting infected. So sterile them, put them sanitizer on them. So that is very important. Some people start having a cup of tea with the gloves on. That's not required. Say when you're going for your duties, you should first have your meal proper, have tea, coffee, go for loo, or go for toilet properly. Get ready. That probably 46 hours you have to be in that dress, and you will not be coming out of that for that period. So those things are important. In between, if you're taking tea or doing something, then it means you are infecting yourself. Rightly, Dr. Assis has pointed out, one of our resident got infected, that we many times we have conveyed to our junior team that the epidemic is not an emergency. Epidemic is not an emergency. So there is no urgency that you risk your life. Do not risk your life. Take time, put your PPE on, and then you face your patient. The girl who got infected have not put on PPE and had gone for the intubation of the patient, and that's why she got infected. So take care. This is not an emergency. First, you take care of your life. If you have taken care of yourself, then only you can save patient. Then only you can help the hospital. Then only you can save our health system. Otherwise, you will not be able to save the system. Otherwise, we are landing up in a crash. If, like we talk about the China, we talk about the Italy. In China, even in the first 1 month only, they had roughly 3,300 workers which got infected. And what was the reason? What was the reason? Reason was primarily they were not getting the PPE. Second, they were not knowing how to use the PPE. Thirdly, when we talk about the Italy also, there were so many deaths, and roughly more than 2,000 people, 2,000 healthcare professionals got infected. And most of the time, the reason are these only. Now, when we have when we have done all the things, we are few important things which we should do in ICU area, especially where the aerosols are being generated. Although Dr. Assis has rightly said, there should be minimum possible doctors or minimum possible healthcare worker in one area when you are attending the patient. Preferably one doctor should attend one patient only, and there should not be multiple entry for that particular patient. If one is doing the intubation, only one person should do all the procedures. So that is the way of protecting others. Then as far as the aerosolized other procedures are concerned, like intubation, CPR, suctions, and nebulization. These are the 4 procedures. One should be very cautious. And when you're doing it, please own the exhaust so that the material, whatever droplets are being generated, they are evacuated. Again, here we all are doing our best. Still, we can improve. We are not perfect. We always make some mistakes. So my message to everyone is that let me focus for, say, where are we getting the things? One, our own way of own way of dealing with the infection. Secondly, the person with whom we are not taking care whether that person is taking adequate precaution. Second person, whether it is the patient, whether it is the patient relative, or some other healthcare worker. If we focus for these 3 points, probably will reduce the infection in the among the healthcare worker. Thank you.
Thank you, sir. So thank you for your great inputs. Yes, it's not always the availability of PPE that's a problem. It's the proper use of the PPE that is oftentimes more of an issue. Let's go beyond the intensive care and the emergency care areas and come a little bit more on PPE. And again, here I'm going to throw open another poll for you. And the poll is again very simple. It asks you, what is PPE? So what do you think? What is PPE? Is it the face shield? Is it the gloves? Is it the mask? Is it the head cap? Or is it the full suit coverall? What is PPE? What do you think is PPE? So we will keep this poll open for another half a minute, and then we will launch into what is PPE and how we use PPE. So what do you think is PPE? Personal protective equipment. I see 40% of the audience has voted, and let's keep it on for another 5 seconds and then we will close it. Thank you. I close the poll now, and what you will find is that 88% of individuals feel that PPE is full suit coverall. There are 9% who believe that it's the mask, and 3% who feel it's the face shield. Well, PPE is just an acronym for personal protective equipment. All those things, face shields, gloves, head cap, shoe cover, mask, goggles, full suit coverall, everything is personal protective equipment. It depends upon where you are and what you are doing, what is the nature of procedure that you are performing, that will determine what is the kind of personal protective equipment that is best suited to you. It's just not the full suit coverall. And often we have the first myth, that is that if you have worn that full suit coverall, you are safe. Please excuse me, you are not safe at all. You have to have a head between your 2 ears and a brain looking at things behind your eyes to make you safe, and it's not the PPE that is going to make you safe. Please use your common sense and your logic and keep yourself safe. PPE is just personal protective equipment. It is composed of all those 3 things. There are areas where a 3-ply mask would be as good and where a N95 would be absolutely useless, but you would need to know by your mind and brain where you need to use what kind of PPE in what situation. We will talk a little bit more about masks in the next slide, and I skipped the mask here. It's important for you to know when you need, what you need, and where you need. That is what is going to prevent and protect you. It's not the PPE that is going to protect you. How to don and how to doff. There is a handout and a video associated with this presentation. There is an NEJM article which has appeared just a couple of days ago, which carries also videos on how you are supposed to wear your masks, how you are supposed to wear your PPEs. Besides that, practically every hospital in the city and the country has made their own videos. Please watch them, any one of them, and use the logic and common sense in understanding what is wrong or right in those videos, what you can and cannot practice from those videos. Rather than just following them blindly, just use your logic and common sense. See any one of them. One of them is included in this webinar also, and please take your decisions wisely. A lot more on masks, because masks have been a real important, or have been a hot topic of discussion in most of our communications in these days. So some questions thrown out at you. Is it lower to pull down your mask from your face when you are eating food? Is it okay to slip it aside while you're talking on the phone? क्योंकि आवाज ठीक से नहीं जा रही थी, आवाज clear नहीं थी. How do you remove it? Do you pinch it from the front and pull it off? How do you reuse masks? And it's important that you look around, see whom you are talking to, what are your colleagues doing? Are they wearing the mask? And if you find your colleague is talking to you without using a mask, shoot him. When you remove your mask for taking tea, remove the lower tie. Don't touch the front side. Keep your mask inside your table drawer on a tissue paper, front side up. Practice hand hygiene after handling it. So every time you've removed your mask, your hands are infected and you need to go ahead and wash your hands before you do anything else. Now, all these questions here are practically self or what they call leading questions in cross-examination. And obviously they have their own answers suggested in them. Obviously, you do not lower down your mask and eat food. You don't slip it aside when you're talking on the phone. You place your mask carefully when you're wearing your mask. Please see that it wears, it's worn closely and it's kind of covering your mouth and your nose with no tiny gaps, which can allow air to leak in, and it's secured tightly. Avoid touching the mask while you're wearing it, as often we have this tendency to like push in here and there, correct your mask. It's not fitting properly. You touch it there and here, and then you start doing a lot of other things, and then you realize that you've got yourself infected. When you are removing the mask, do not pinch it from the front. Remove it from the sides. Open the lower tie first and then the upper tie if you are taking it off. After you have removed, clean your hands with an alcohol-based hand rub or wash your hands and replace the masks as soon as they become torn, damp, or visibly contaminated. Please remember, I tell often in my wards, and I am sharing this again with you, we are lucky in GTB Hospital that we are getting a good supply of PPE and masks. There are other places in this country and there are other places in the world, especially the United States of America, where all of us have aspired to go at some point or the other, where there is no availability of masks. Our residents who are practicing there, our alumni who have passed out from UCMS and gone there, bring us back stories that they have been given one mask and they have been told to use it till the end of life, that no mask will be replaced because they don't have masks. If you are getting an N95 mask, please appreciate that you are getting gold in your hands. Try and reuse it, although it may not be in the guidelines. You may be told in the guidelines at this time that you can, it's a one-time use mask and you change after 6 to 8 hours. But most of the guidelines will be changed based on the availability of PPE in the near future. And if you are getting the masks now, please use them judiciously and wisely before you run out of them. And if you run out of masks, or there are some resident reports who are using 3 or 4 masks in one duty. Please remember that if you are using more than necessary, then you are probably depriving another one of your colleagues when they actually require it, or you yourself might require it tomorrow and there may be no more masks to provide. Before I take this poll, I see Dr. Piyush Gupta has been able to restore his microphone and he's already in the webinar. And may I invite Dr. Piyush Gupta to share his comments and his suggestions and tips. Professor Piyush Gupta, sir. No, you're not able to get in. So like, fair enough. I will throw open again this another poll to you, which asks you like, who do you think poses the most risk to you? And the poll is now open. You are invited to reply and respond on the poll. Who do you think is the one who's going to infect you your most? Who's most dangerous around you? So please remember, there are options of raising your hand and there are options of asking a question. If you have something to comment or say, please feel free to raise your hands and ask questions. I'm trying to answer those questions as we go. We have had quite a good response on this poll, and I'm going to close it in another 5 seconds and share the results with you. So most of you, 60%, say that it's the patient whose COVID status is unknown. Exactly, very true. But this poll, with this poll, I wanted to highlight that you also need to be careful of your colleagues whom you don't realize that may have been exposed, and you are associating with them and working with them. And you really need to be careful at a lot of times. A COVID positive patient, of course, poses a risk, but if you know that the patient is positive, then there is really, you would be doing everything to protect yourself and may not really actually pose a major risk in that way. So we'll come on to reports, and at this point, we will have inputs from Dr. Rahul Sharma on what's happening in the community and how the transmission in the community is proceeding before we go on to the report section. Dr. Rahul, yourself.
Thank you, Dr. Ashish. And it has been really been educated. I've been making notes of whatever has been talked so far. If I'm correct, I think most of the attendees today are residents, young residents that were on the path of this one. Doing the clinical part of it is already a tough job, and to have the public health aspect also dealt with it. But that's a part of the job that you all are doing. Let me just remind everyone who's listening in and who's sharing the time with us, along with your space and the time that you're spending in the hospital itself, we all also are spending time in the community. So it's a vital part of our job to know what is happening inside as well as outside our own premises that we are doing a duty in. Probably I'm not exaggerating in saying that while the hospital is the risk situation or is a placement where we all are scared or we all are apprehensive of what is going to happen and how we are dealing with the corona patients and the corona scare that we all are facing. But probably the more risk to us is coming from the community itself, because the majority, the numbers are more happening in the community itself. I'm sure all of you will be following the debate upon whether we are on the stage 3 yet or not, or we are still in stage 2. But I think it's far past that debate now. We started off with 1 or 2 cases at the beginning of the year in March and all from 50, and we have reached a stage where there are 5,000 known cases happening on a daily basis. So I think the debate is not now whether we are in the community phase of transmission or not. The transmission is happening, whatever stage we label it to be in. So let's be aware of what we can do, and let's be aware of, I just want to share what public health is doing in tackling this thing here. Dr. Girisa mentioned a very important point, that this is not something we'll be wishing away with either in the next 1 month, either in the next 2 months, or by the end of this year. It's something that we probably will all be living with and assisting with for a long period of time to come. We have done that earlier. It's not the end of the world. We have, and public health has had many successes, including many big ones when we thought that we will not be able to do something. And we learn to live with this also. The government agencies are trying their best to do multiple things possible. And if you will share the handouts that Dr. Ashish has shared, which are very useful clinical ones, one request I'll make to all the young residents would be that the official source that you all can look for is the Ministry of Health and Family Welfare site. That's www.mohfw.gov.in. That's something that will keep us all updated on a large level. I'll not share too many of the documents there. That's something available to all of us there. And the guidelines are evolving on a daily basis or on a very fast basis. What's happening essentially, and what Ashish probably wants me to do is to update you about what's happening at the community level. India is way past that stage where only the travelers were infected, where our initial response was at the airport and the points of entry to the country as a whole. We are probably dallying somewhere between the local transmission and well-established community transmission. The official stand still is that the community transmission, if at all happening, is still localized to some clusters and all. So the response from the public health functionaries and from the government side has been a cluster containment approach and a large area containment approach, depending on what is happening in that specific area. Essentially, in both the things, we are having active screening. We are going out, doing a line listing of identifying people of cases, putting them to the right treatment possible, referring them to further treatment, and trying to find as many more cases as possible. The numbers still probably represent the tip of the iceberg. There are numbers who have been tested. The testing strategies are changing very fluidly. It's a fluid situation, and that's why I would request you all to keep following that government source to find out what we're doing. If I'm correct, that even the discharge strategies, what is to be done at the time of discharge, how many tests to be done, even that is changing with the period of time and all. The community transmission is here too. The community transmission would be there. I don't want to create a scare position, but probably the numbers will go on increasing. A large part of the Indian diaspora would get infected, if not within the next 1 month, by the end of the year also. So that's something that we all have to be prepared for. The lockdown that was there, that we all faced, being a doctors, we faced problem at the borders and coming and reporting to a place of work. That was something that is a part of job, because even the administrators are trying the best. Epidemiologically, it makes sense to keep everyone separate. That is the best possible strategy. But there are many variables and parables that have to be taken into account. The lockdown is letting down there. So it is not time for us to let our guard down, because now is a time when people will be mixing together. There'll be people coming to the hospital from multiple more areas possible than earlier. As they say, for universal precaution for HIV, probably the time has come now for my clinician colleagues will probably discuss more upon that. It's a time for universal precaution regarding corona also. Rather than going for a test and rather than wanting to find out whether the patient whom I'm caring for is corona positive or not, let's essentially take anyone who's coming to you as a possible one and to try to maintain our PPE and the other things that have been mentioned to the best possible. What would be the exit? I'll just end up with a point that the lockdown is ending now. So what will be the exit strategy post-lockdown? There are 3 or 4 things which are very clear. There has to be a paradigm change in our behavior, and that can be done. Being a Delhiite, for the people who are Delhiite, I think till few years ago, hardly you saw anyone at all wearing a seatbelt. The seatbelt used to be there very well. The car manufacturers were putting it there, but I rarely, if ever, found anyone using them. But times have changed. There was a penalty. The people were afraid of the penalty being imposed by law. People made that change, and finally it has become a part of behavior. So much so I can speak for myself that I don't now even notice when I'm putting my seat there at the time of getting into the driving seat. So probably the things mentioned by Dr. Giri sir about donning and doffing and about following the precautions and all, that will hopefully become a second nature for us. But now is the time to be making very clear that that becomes a part of a universal precautionary behavior in a hospital as well as in the community where we all are interacting with as a citizen of India also. The 3 or 4 things which will definitely be there would be social distancing. That will have to become a part of life. There will have to be mass mobilization. There will have to be more informal infrastructure improvement will have to be there. And the third part of that is that the vaccine and all, which hopefully will be coming at the soon. But at the time, by the time it comes, our own behavior, our own preventive behavior will be making a big change to keep the epidemic at bay. That's about it, Ashish. That was, I think, what I would want the clinicians to share from the public health point of view. And probably the questions can come if they want anything more specific regarding the community transmission which is ongoing there.
Thank you, Rahul. Thank you for a wonderful inputs. And if you have any questions, again, please push in your questions into the question box below or raise your hands and I will be happy to take in comments from here. Let's go on further from here, and I will go on and talk a little bit more about reports. I believe, and I would like to tell you that a negative report or a positive report is a mirage, is actually a mirage. Treat every patient as positive till, read that as even if they are proved otherwise. A positive patient, while may be harmless, a negative colleague may not be as harmless. So stop eating in the mess or in the canteen. Preferably carry your food and eat in your rooms. And don't talk while you're chewing food, because it's been seen that the moment you talk while you're chewing, you spread the droplets even further. And if you are having tea clubs and community lunches in your departments, please stop them now. So at this point, I will take on another poll here. And this poll is a little more interesting than the ones before. And this says, what will you do if you get exposed? And there are 4 options. I know, I'm already prepared. I don't know, I never thought about it. Oh my God, I'll panic. Or will you phone a friend? So that's it. It's open. You can take the poll now. We will keep that poll open for the next 30 seconds or so. Simple poll. Do you know? Do you not know? Have you never thought about it before? Will you panic or will you phone a friend? I will close the poll as soon as about 80% of us have voted, and we are getting a good response on this poll as well. So what will you do if you get exposed or infected? Do you know and are you prepared? Or you never thought about it? Or you will panic? Or you will phone a friend? So another 3 seconds and we'll close that poll. Yeah, thank you. So I'll share the results. What happens? So almost 2/3 of the audience says that they know, that they are prepared. That's extremely good. I think that's a fantastic figure, that if you really know what you are going to do, and if you're already prepared, that's the best that you could do. And probably you don't need to be on this webinar, or you need to be on the panelists and teaching the others. And but there is quite a good number of you who say that you have never thought about it, and that's a more difficult thing to handle. So at this point, again, now here, once you get exposed, what happens then? So I have here things like what you should know. If you have symptoms, what will you do? What happens if you test positive? And here I would like to play a video by one of our own students who was in the hospital, and he was tested positive. And that's when he made this video when I requested him.
Hi, this is Dr. Weber. I'm a surgery resident. Even before I was handed over my test report, I was quite suspicious of having COVID-19 because of the set of symptoms I had. And by the time my reports came, my symptoms had already started improving. But yeah, speculating is one thing and confirmation is another. And when my confirmed report was handed over to me, I was scared, terrified, and my mind was filled with all the ominous thoughts. Thankfully, the journey was not as difficult as I had first imagined, and all my symptoms improved within a week. I did not develop any complication. The anosmia did trouble me initially, but it's going to be a month now, and much of it has improved. The most important factor which helped me tide over this crisis was the support of my friends, family, and teachers, and without them, it won't have been possible to spend 17 days in complete isolation without any human contact. For me, more than the physical discomfort was the mental anguish that troubled me. And a large part of it was relieved when I came to know that all my contacts had tested negative. On a positive note, this disease did teach me a lot about my priorities in life and made me realize the worth of all that life has given me. I would like to say that until we have a drug therapy or a vaccine, we are left with our immune system to deal with this menace, and to keep it strong, we must keep positive thoughts in our mind at all times. Thank you.
Thank you. That was Vaibhav, and he wanted to share that. But I can tell you one thing, that when I was interacting with him during the time he was in isolation, Vaibhav came out to be a very positive boy in everything that he did, and probably that's what helped him tide over that period of isolation so closely. There was another resident who tested positive, but when I asked him, he said he did not want to be identified, but he shared this audio clip again for all our viewers, and this 2-minute audio clip is coming on for you now.
I contacted COVID-19 from a patient. While I did the aerosol generating procedures in that patient, I did EP suction and ambidide ventilation, and the cumulative duration of exposure was about 45 minutes to 1 hour. And while EP suctioning, I had some flashes of the secretions on my face. But still, even though I wiped them off and cleaned it immediately, the contamination of my personal protective equipment had happened. In terms of PPE, I was wearing a gown, I was wearing gloves, an N95 mask, a surgical mask over it. I was not wearing a face shield because I did not have a face shield at that point of time. And I was taking due precautions as we had treating the patient as a suspect anyway. She was later found out to be positive. So after around 6 days, on the 6th day of exposure to that patient, I initially for 2 days I developed retroviral pain. I had malaise, neck stiffness, slight body ache, and very slight nasal stuffiness. I had no fever. I had no cough at that point of time. Then by day 3, for 2-3 days, I had only fever, which ranged from 101 degree Fahrenheit, and the quality of the fever is that it was associated with very severe body ache, and it wouldn't break even with the PCM, and I had to take Nimsolide, and till the effect of Nimsolide remained, I used to stay afebrile, and then it used to come back, and it was a very terrible feeling when you had fever. Till that point of time, I had no respiratory symptoms. It was on day 6 that, along with the fever, I developed slight chest retrosternal pain, which was aggravated further on deep inspiration, coughing, yawning, and very mild cough. So I hadn't imagined that my symptoms would worsen even beyond this stage. The next 5 days very tough for me, because in addition to the fever, body ache, extreme weakness that I had, I developed severe dry spasmodic cough, and it had a very bad associated with very bad chest pain. My breathing became very shallow. I could barely speak because of dyspnea. I had paroxysms of cough. I used to wake up in the night and cough. I had to take inhalers, and my saturation came down to 94. Then there were episodes of dyspnea on and off, and speaking also became very difficult at that point of time. And so much so that I would call it a near-death experience, because I thought that I would probably not make it beyond this. However, by day 13, my condition started to improve. I became afebrile. My cough improved, and and only had occasional spasmodic cough. However, there was a very irritable feeling inside in my chest all the time. And even on day 21, 3 weeks post my first symptom, uh, I still continue to have a cough and occasional episodes of dyspnea in between, and still need inhale.
Thank you. That was one of our residents with her symptoms and explanation. So with this, I believe that it's a lot of mental anguish and trauma that individuals go through. And it's not easy to address this anxiety and stress which comes on with the positive report. And here I would like to bring in inputs from Professor Shruti, who is on the panel, and the expert on mental health. So Shruti, please tell us how the residents can help. And before that, there is a poll that I would like to bring up again for you. So this poll asks you a question. What behavior changes have you observed in yourself during these times of COVID? You've started wearing masks and improved your hand hygiene practices. You've stopped walking in the campus and talking to people or friends. You've started exercising or doing yoga regularly, or you've had more positive thoughts to cope up with the stress. Please do share your inputs on these particular points, and what's been the most important behavior change. And in this, you can answer more than one positives. So if you have more than one answer, you can click on more than one answer also in this poll. I'll close the poll in another 10 seconds. So you have another 10 seconds to answer this poll, and you can answer more than one responses. So fair enough. I'm closing the poll now and sharing the results with you. So here is it. There are obviously most of us have started wearing masks and improved hand hygiene, almost 90% of the audience. We've stopped talking and walking in the campus, talking to friends, about 1/3 of us, and we're doing regular exercise, 1/4 of us, and we have positive thoughts in our mind, 1/5 of us. Dr. Shruti, all yours.
Yeah, so all of us have done some behavior change or the other in the last 3 months or so of this COVID experience that all of us are facing. Now, the thing is that we have made ourselves accessible to all of you through telecounseling services. We are both Dr. Bhatia and myself. Our numbers have been put on the DU website. We are available round the clock 24/7. And on the WhatsApp number, anytime, any faculty, resident, or a student or an employee can WhatsApp our complaints to us. And during the next working day, between my time is between 10 to 1, I will make a consultation, telecounseling call, and I will be extending telecounseling services. So that is as in when required, if one feels uncomfortable with these kind of panic issues or with kinds of difficulty in coping up. I have lot of cases from the hospital staff who are being posted for COVID duties. They are having, and there are a lot of problems which they are facing otherwise, because they have to stay away from the family, away from home, and they have to stay in separate areas. Sometimes they have to quarantine, keep themselves in quarantine. Then there are a lot of family problems out there when the family is living alone. So many such kind of instances are there, and we are available round the clock for extending our emotional support and for providing emotional support and counseling for all of them, for everyone. That is point number one. So teleconsultation, telecounseling services we are providing. For the prescription, if the symptoms are very severe, if you are not able to control any of these panic symptoms, or if you're feeling too low, or if you're feeling too anxious, or if you're finding problems in adjustment, I would request you to come for in person for consultation, rather than just being on counseling. So that is point number two. The point number three is that we need to bring in behavior changes in ourselves. We need to be more cautious. We need to be more preventive, and we need to keep ourselves safe. So just by saying that we will keep ourselves safe is not sufficient. We need to bring all these behavior changes. Just think, just as we say, always say, think before you speak. The thing now I'm going to say is that think before you act. So if you are walking for to a canteen, or just a takeaway place, for just buying a drink for yourself, then just think for a minute, is it worth an exposure? Can't you just simply squeeze a lemon and in your glass of water add a common salt and drink it? Is it worthwhile exposing yourself to a takeaway joint? So that sort of behavior change is what is expected, that you think before you act, and you avoid all the things which expose you. That is another thing. And keep yourself positive, because there's a lot of role of psychoimmunology which will help you conquer the disease, and this will help you conquer the battle. So far we've been doing very well as per the statistics from different other medical colleges. I'm a pass out of BJ Medical College Pune, so I talked to the friends there. We are doing much better here, and so we must keep our spirits high. We must keep positive thoughts in ourselves, that we will be stay together, stay integrated. We have to use our coordinated efforts, and in reaching out a person, in a colleague, on a phone is always advisable. Please talk to someone whom you feel comfortable. Please speak to that person, known family member, friend, or a colleague every day, on a daily basis. Please do something to keep yourself happy, to do some recreation, just playing a game of chess, or playing a game of Ludo, or just playing a game of Tambola, or any online, offline games. Please do that, and indulge in physical exercises, plus keep a balanced diet. That's all.
Thank you, Dr. Shruti. So since we have already run out of the scheduled time, I'm just going to take the take-home message here. There are about 8 to 10 points that I jotted down. And after that, those who wish to stay on, there are 6 questions that we have already received. I'll take them one by one and open those questions to the panelists also. In the meanwhile, let me complete this with just the take-home points that I...
Hi, this is Dr. Weber. I'm a surgery
I
resident.
contacted COVID-19. I contacted COVID-19.
Yeah. So the take-home messages, very quickly, I'll just wind them up. Minimize phone use in patient care areas. Hand hygiene after removing the mask. So it's more important that you keep your infected mask appropriately and don't infect yourself, reinfect yourself with that mask. Face shields, eye protection, masks in the OPD, and please do take care of the circulation. Open that closed window. Plan your visit in the inpatients, plan, replan, and then execute. Minimize the contact. Do much more in that single visit rather than visiting those patients again and again and again. Stay out when an aerosol generating procedure is being conducted. You don't need to hang around and learn the procedure at this point of time. There will be more opportunity. If you are wearing a PPE, don't think that you are wearing the suit of armor which will protect you against every bullet in the world. So still not safe. Use your logic and use your common sense. The negative report is a mirage. Don't depend on it. Stop your tea breaks and please stop those lunch breaks which you are having in a group. If you're exposed, stay calm and approach the quarantine authorities in the hospital. And lastly, please remember, sabka number aayega. Thank you. With this, I take up some questions that have come in. There is Dr. Darshan who's asking, what is your call on reinfection? Let me open that first to Dr. Rahul. Dr. Rahul, Dr. Darshan is asking, what is your call on reinfection? Would you like to address that question and throw some light on that? Rahul?
Can
I
you hear
think
me
you're
now?
not audible.
Yeah,
Yes,
can you hear me?
better.
Yeah. There are, I think Dr. Darshan's question is quite valid. There are reports coming in from China and Korea that there are people who have been reinfected even after gaining immunity. That does throw a spanner in the works. I'm sorry, I won't be able to offer exact literature to back up on that to either defy or that, but anecdotally I've heard of cases being reported on that. And probably that just makes our role a little bit more stringent, that whatever we've discussed so far over the last 1 hour, that the safety precautions that we have to follow probably will have to be on the larger. Sabka number aayega, sabka number dobara bhi aa sakta hai. So probably it just means that we have to be more stringent in the precautions that we are following.
Thank you, Rahul. So I get asked that question every time that we do a webinar. It's either one of the people who's already come out of the infection who's asking it, or there is always someone who is worried about what is happening next. So as of now, as of today, most of your public health models or most of our public health disease models are based on the SIR principle, that is SIR. We divide the population into the suspected group, the infected group, and the recovered group. So most of the modeling is based on the principle that the person who has recovered is no longer susceptible. However, that model will be put to test as time elapses, and we really don't know if that model will hold. There have been some anecdotal cases from Korea and South Korea largely, where they have said that people who had recovered again tested positive. But then there were refutals, rebuttals, and we really don't know the exact picture as of now. There is no evidence which concretely or undisputably suggests that these individuals can get reinfected. So as of now, we presume that our SIR model of disease will hold, and those who have recovered are not susceptible. Professor Giri, would you have any additions or any thoughts on this further? Because I get asked this question all the time. Yes. Dr. Giri.
The probability of reinfection, the study in UK which they have taken up, that how the people in healthcare, how the reinfection has occurred. There also they found few people have acquired it second time, and even 2 people have acquired it third time also. So there is a strong probability one can have, but let me first deal up with the first infection only. Let me come out of it. That is my take. So a protection, behavioral changes, all these things we have to follow.
Thank you, sir. I go on to the next question. This says, is there any role? Hemika is asking, is there any role of herd immunity in the pandemic? And why is SARS a non-issue today, despite the lack of uniform vaccination? Rahul, again, I think you would be the best man to handle this.
Ashish, I just missed out the second part of the question. Can you just, because I'm not able to see the question, unfortunately. Can you just tell me the second part of the question?
So, she's asking that why do we not see SARS as an important thing? Yeah. What is herd immunity? SARS, that is severe acute respiratory.
Okay, sure. Herd immunity definitely, as if you would recall, since we all are doctors here, herd immunity would be the end game strategy in a way there. For herd immunity to be there, it will have to be, it's a new disease which has come up there. Traditionally in communicable diseases, we want the herd immunity, we expect the herd immunity to play a role or to kick in after at least 60 to 70% of the susceptibles, as Ashish mentioned, have been infected. It's a game of cat and mouse between the virus, which is looking out for people to infect, and between the availability of others. I don't want to go back to the basics of public health. The way it works is that if sufficient number are infected, are now no more susceptible, the virus will not be able to find out its way to the susceptibles. And for that to operate and for that to help us in public health, you would need a larger number of the people to be non-susceptible now. I don't have the number to offer you, and nobody probably will be having the number till the time corona actually spreads its way through, but we can have hazard a safe guess estimate as 60 to 70%. Having said that, that would not something be, that would be the fallback option for the simple reason that as the disease is panning out its role right now, about 80 to 85% are recovering well, and there's no issue there. 10 to 14% are reaching hospitals, including ours, and 4 to 5% are reaching the highest level possible. So we would not want that to be happening by the time 70% of India gets infected. So my only additional point to what the question that you were asking was that herd immunity would definitely play a role, but as a public health measure, we would want it to be the last fallback option there. We would want our initial active roles to work further to it. Regarding the question about SARS, it's still there. This is SARS-CoV virus 2 acting up initially, but I am failing to get whether you're wanting the connection between SARS itself that was there earlier. I hope I'm not missing the question itself, but SARS in 2003 was a wake-up call. That was a time where the measures did help, where the precautionary measures that we all were taking and the rapid response teams that were there and the active screening that was done, we were able to take care of that epidemic to a large extent there. This one is a tricky customer. It is an evolved one. So the hope is that we will be able to do that. Despite the lockdown, if you see the figures which are there in the public domain, the flattening of the curve is still to happen to the extent that we were wanting it to be there. So all the more reason for us, all the attendees of this webinar, to be on the alert, to be on the toe, that we keep safe ourselves and we also are not able to transmit the infection to others or not. I'm not sure if I've been able to answer the second part of the question.
Thank you, Ram. So yes, so probably what happened to SARS, why do virus diseases die? Obviously the viruses mutate, we develop more immunity as time passes. There is an antigenic shift, there is antigenic drift, all those factors do play in, and then we see a change in the disease profiles. I'll go on to the next question. Sudhakar is asking, the students infected with COVID-19, what PPE they were using. I think both the students described exactly what PPE they were using, and I'm not going to take that up in any great length beyond that. I will come on to Dr. Dheeraj Shah. Obviously, Dr. Dheeraj has been known to ask difficult questions, but instead of reading out his questions, since he is already here, I have unmuted your mic, Dr. Dheeraj, and why don't you ask the question yourself?
Oh, so
Dr.
Did I use a wrong link to join? Am I there with you? I didn't know. I thought I'm one of the participants only.
You are very much with us as a participant or as a panelist or a faculty, as an organizer, whatever role you choose.
Oh, so I think I crashed somehow. Maybe Dr. Piyush sent some link.
Don't worry. You are right there where you were supposed to be. Just relax and you can ask the question directly.
My issue is that now, even yesterday, I faced a problem with one of my senior residents who turned out to be positive.
And Shruti, it is coming to you. Yeah, I just butted in. Shruti, this is coming to you.
So it's like the authorities, they treat as if the house is on fire. So most of the health workers are now scared of the social consequences rather than the disease itself. Nobody is worried about disease. First, they are worried about their family, their children, in case they are isolated and taken to some other, some remote area for home quarantine, for institutional quarantine. So they are more worried about these aspects, and somehow the governments, and even I would say that all of us have also contributed to this panic that this disease is something very, very unique, and it will kill all of us. So how to take care of this at this point, that how to remove this fear from the society? Dr. Shruti will have important, how can we remove this fear and panic from the society?
Sir, this is, my advice is that this is just, we should consider it as an infectious disease, and we should stay ourselves positive, remove this fear, because 85% in my presentations also I've spoken, 85% of the patients are going to recover completely. Only the ones who have comorbid illnesses, pregnancy or elderly, we have to be a bit more cautious. And that is why previous government guidelines of quarantine were extended to all, but nowadays it is not so. Even the mild patients, mild sufferers, they can be in their home surroundings. I have colleagues, psychiatrist friends who have preferred home quarantine rather than doing any quarantine in other places. And there is just one thing which even the videos for people abroad, they have only one single toilet. The ethics or the etiquettes of maintaining hygiene need to be followed. That is, if the patient is suffering and there is only a single toilet, please let other family members use it. Just use it after that, and sanitize it. That is the thing. And isolation is just a one room setting with an open window. That is all which is required. So preferably the other family members can be in other room setting, if there are two rooms in a house. The other thing is that chemo prophylaxis has not been brought up, but chemo prophylaxis, most of the healthcare workers, most of the residents, and most of the interns are taking, but with due precautions. Of course, QTC intervals have to be monitored and they need to be taken care of. The problem is the stigma. There is a lot of stigma. The house is getting blocked, and it is made awareness about the COVID-19 is coming on the Arogya Setu app, as well as it is coming on the house building also. It is coming. The neighbors are informed, and everybody looks at the person who is infected in a different sort of a manner, and that all mindset has to change. The society has to, and all of us as colleagues, we have to extend help to each one of us. So we have to make ourselves available for all our friends, all our colleagues, all our professionals who are with us. So same goes for the resident also, that if there are mild or there are symptoms of one which do not require oxygenation, or which do not require spontaneous oxygenation, the symptoms can be very well managed in home with a home diet, home surroundings, positive taking care by the family members. They also need to, there are guidelines how the family members who are taking care of COVID patients, they also need to wear gloves. They also need to be very careful when they wash the clothes. They have to sanitize the thing, and the food, and the food has to be provided. It's a healthy balanced diet which is to be provided with medicines which are bringing about a good response, as all of us have seen. So there is no need to worry, or there is no need to panic. In case there is breathing difficulty, or in case their symptoms exacerbate, then only the hospitalization is what is required. Rest of the other cases, and once the patient is suffering, as all the students have said, please listen to music, please listen to whatever you can listen. If you have faith in God, then you can do any of the religious practices, pujas, or going church, or any religious faith if one has. And it is always be positive, be optimistic. The outcome of the disease will not be so bad, and with due precautions and with timely intervention, most of the cases we will be able to manage without any hurdles.
Thank you, Shruti. So I will take a rebuttal. Okay, Rahul wants to take that. Yes, Rahul.
Okay, very quick. Just a very quick add-on to what Dr. Shruti replied. Sir, you are very right in asking. There are some things which are out of our hand. Probably, I think all of us are facing this, the bombardment of information regarding COVID. You're opening your social media, you're opening your normal media. There are negative news coming, there are positive news coming, but everything is probably adding up to our brains and all. My only small 2 points of take would be that a very cliched statement is there to act as an agent of change. I have seen it happening in my doctor's group and all, that among the social media messages coming, we sometimes forward them as a matter of force. We don't even think about it. So probably that will be a very small positive step that we all can take, that not to add to the stigmatization by being positive and being very finicky in what we are doing with our social media behavior. Because when we forward as a doctor, we sometimes don't realize that in a non-medical group or in a group of collegiate students and all, what we are putting forward as a normal way of habit and as an interesting, I would say, a masala forward, that may carry much more value for the people around. So let's be cautious. I agree to a point that the stigmatization is there. There's a panic reaction happening at the community level. The media may be responsible to that for that, but there's some things out of our hand. So for the attendees of this webinar, I'll just make this one small statement to be careful in what that we should not be adding to the stigma there.
Thank you, Rahul. And another two quick rebuttal points on those. Sir, आपने कहा fever.
Dr. Ashish,
Yes,
I want to.
Yeah, please go ahead.
Dheeraj has rightly said, Dr. Shruti has explained it well. Dr. Rahul, you must be agreeing with me. The outcome of this disease in India should be far better than the Western world. Our population is young. Our immunity is far better than those people. I think Dr. Dheeraj Saab will agree. Our mortality is far lower than the Western world. What do you say about it?
So, yes, of course, so far we've been doing better than the other part of the world, but we need to see what's happening, what's going to come on next. Yeah, so my quick 2 points on this was fear. आपने कहा fear कैसे हम handle करेंगे? Actually, आजकल सड़क पे चलो तो मुझे समझ में आता है fear है कहाँ? दिख नहीं रहा, सब लोग तो सड़क पे ही हैं, पूरी दुनिया दिल्ली में बाहर निकल आई है. Where is the damned fear? दूसरा, what will happen and how this will change? How will we get out of the stigma and the fear? So I don't have a degree in psychiatry or psychology, but what common sense and logic tells me कि शायद जब एक threshold number of people get infected themselves, then the stigma will go, obviously. And जब इतने लोगों को infection हो जाएगा कि दूसरे को फिर क्या stigmatize करेंगे वो. And fear, Shruti's shaking her head, but that's what I take on it. And fear, when you see that more and more people are recovering out of it, then probably the fear will get less. And if we find that more and more people are dying out of it, then the fever will aggravate. Obviously, that is going to change. And we are seeing that कोई भी government directive या कोई भी instruction या कोई भी notification का shelf life इस समय कुछ 48 से 72 घंटे से ज्यादा चल नहीं रहा है. So whatever guidelines on quarantine that we are getting are changing so rapidly. जैसे जैसे number of cases बढ़ रहे हैं, the guidelines are based less on science and more on availability. So जो हमारे पास facility available है, उसके आधार पे guidelines change हो जाएंगी. जब हमारे पास facility available थी, तो हम अपने अस्पताल में चाहे वो पॉजिटिव हो और एसिम्टोमेटिक हो, उसको भी भर्ती करके रख रहे थे, उसको बिल्कुल बाहर नहीं जाने दे रहे थे. बट जैसे जैसे अवेलेबिलिटी कम होने लगी और डिमांड बढ़ने लगी, तो हमने कहा जो माइल्डली सिम्टोमेटिक हैं, जो एसिम्टोमेटिक हैं, घर चले जाओ, अभी सिर्फ सिवियरली सिम्टोमेटिक यहाँ पे रहोगे. सो दैट इज गोइंग टू इवॉल्व. जैसे नंबर और बढ़ेगा, these numbers will also change, these guidelines will also change. So that's about what I'm had to say on this. I'm coming on to Dr. Vinita Rathi, and since she is also on the webinar, ma'am, I'm unmuting your mic, and you may please raise your comments and concerns, and directly this addresses whatever Dr. Giri was commenting on earlier, and Dr. Rathi has got an important take on that point. Dr. Rathi.
One thing I said was that Dr. Giri has talked about plastic curtains. We have been recently seeing videos on WhatsApp also that aged people are communicating with their grandsons and granddaughters and sons through this plastic curtain. Their hands they put in their gloves, and through the holes they are hugging each other. So not that, but if these sort of curtains were available in the hospital, they would even make our imaging department work very easy, because we can be the person who is doing ultrasound or doing an x-ray is touching the patient and being exposed for a period of 5, 10, 15 minutes. So if these curtains are very simple curtains, if they can be available, then just a hole through them and we can examine the patient and do a proper radiological investigation. That is one thing. And the second thing I want to ask is that most of our patients in the ward, even those who are COVID positive, I think every patient is carrying a mobile phone. So is there Arogya Setu app on? Or can we ensure that it is on? So does it give some sort of indication to people walking around, or especially for my department, I'm concerned because my residents really don't come to know who is positive and who's a suspect and what is the degree of suspicion of COVID the patient has. So if that app is on, then
Yeah.
we can
So yeah,
sort of
we can take that
check
question. I
or
think Rahul, would you talk about the Arogya Setu app?
Yes, ma'am. Just to clarify on one part of that, you rightly said that the Arogya Setu app can be something that can really help us in that. But I must clarify one thing, ma'am. It will not tell your residents immediately on a real-time basis whether a person is positive or not, for the simple reason of breach of privacy. The way the app is designed to work is that it will collect the information from the Bluetooth data, and the person's ID would be uniquely, the unique ID will be shared with your phone, but not with the name and all. It will not be linked to a name and all. So after a period of time, you'll be able to see whether the resident, whether the person who's carrying the app has come in close contact with somebody who has been positive, but it will not reveal that to you on a real-time basis, because then you can make out that who is the other person there. It will just help you in taking general precautions. So I just wanted to clarify on that aspect.
Yes, and in
But
addition to that, it will only have a geopositional system. So it will just geographically measure the diametrical distance between two mobile phones, one which is positive and one which is negative.
Actually, just to add on that,
Yeah.
it will also tell you that whether you have come in close contact with a person who has been positive. It will tell you that, so that your preventive measures or your subsequent measures can be measured as per that. So it will, along with the diametric meter, it will definitely tell you that whether you have been exposed to someone positive over a last period of time, but anonymously. You will not be able to do that, ma'am, on a real-time basis.
Yeah, exactly. It will not
yeah,
protect you.
so
It is not
that
going to give
would
you any
also
protection
help.
per se. Yeah, it will not help you in
Okay,
taking
but that
protection. It
also
will only tell
okay.
it will only tell you that you have during this day been exposed to somebody in the day. And when
Someone
you are
known
coming to a
positive.
hospital like GTB Hospital, then you are exposed to practically everyone who's in 2 meter distance with you. And there will be like somebody standing across the wall who is positive, and your app will start showing that you have been positive. Regarding that question on the plastic curtains, yes, plastic curtains are definitely a good idea, and nothing stops the radiology department for asking for those plastic curtains. And in these times, I don't think any demand is being rejected or refused. So if a proper demand goes through your department to the MD, and you can easily push forward for something as simple as plastic curtains with holes, which can help protect a lot of the healthcare workers in the radiology department. And that would be a fantastic idea per se. And I'm going to take the last question on this. So Dr. Rakesh Sood is asking, what happens if a hospital manager or a hospital desk person who is doing the registration gets exposed and tests positive, while the other people in that same room were negative? The only comment I would say is that what can they do next? Probably there is a problem with the circulation there. Even if they were wearing PP, they can add the face shield, which the person may not have been wearing, and you need to increase the distance between the individuals in that particular room. I think with that we are finished with the questions, and we have also exceeded more time than we had allocated to this. So one last final comment from each of the panelists, and then we close this off. So for the final comment, I start with Professor Giri. Your last final take-home comment.
I'll say first, to control the source, have proper trials of the patients, taking all precautions, and treat anyone who is coming to the hospital and who is likely to be positive as a positive one, so that you can save yourself, you can save the society also when you are saving yourself. When a doctor, when a nurse, or any other healthcare worker is saving himself, is basically a boon for the society. If a healthcare worker is saved, then only the society will prevail. Thank you very much.
Thank you, sir. Shruti, a quick,
Stay
brief comment.
positive. Stay positive. Keep optimistic. We are all together.
Thank you. Rahul.
I'm in preventive medicine side, so I'll end with a preventive message. Ashish began by saying "Sabka number aayega." I'll just give a positive spin to that. Sabka number aayega to stand up and be counted. Diffusion of innovation theory says there are some innovators, there are some early adopters, there are some early majority, late majority, and then the laggards. I can see that 37 people still standing after 90 minutes of talk. So the ones who are here are definitely part of the innovators and the early adopters. Please do maintain that. and innovate, because this is a time that is upon us. It is upon us to make the best of this challenge thrown by nature to us. Thank you.
Awesome. Thank you. Thank you everyone for joining in and staying so long. Thank you and have a good rest of the evening. Stay home, stay safe. Thank you.
Thank you.